Well, there have been some very important recent developments in terms of anorexia nervosa psychological therapy treatment trials. We've had a very large one just completed in Australia I was involved with, where we looked at 3 different therapies for people with eating disorders with anorexia nervosa in outpatient settings. So I think the landscape has changed significantly recently in terms of what psychological therapies are evidence-based in anorexia nervosa and what are most helpful for people in anorexia nervosa. And it has been interesting to see that some of the staff here at Wesley have been learning about those as well and have gone to workshops recently, for example, for specialist supportive clinical management at the ANZIAD meeting last year. The director of the day program was just telling me about how she had been learning about that and been to a workshop about that. So I think in terms of the research, the current research that's going on and is continuing to go on in terms of developing treatments and treatments that work in anorexia nervosa. But also I think the research can help a lot in terms of improving the experience as an inpatient and the hospital experience for people with anorexia nervosa. So some research into learning about those regimes that we use, and we're looking at perhaps having a research project here around whether people need or don't need to know their weight. The current practice is people are told their weight, but that is stressful for people and can lead to distress. So sometimes perhaps we don't tell people their weight, but we don't know if it's actually an important or necessary, or for whom it's most important and most necessary for. So we're looking at having a trial where we trial people knowing and people not knowing their weight in the program. The other issue is how quickly to sort of gain weight in hospital, and there is a bit of a push internationally which has said we've been offering weight regain too slowly and that people should be gaining weight more quickly. And there's one program in Sydney at the Wesley Hospital where they've been looking at much more rapid sort of weight gain, whether that in an adolescent setting, whether that works as well in our setting or in adult settings is unknown. So that's a whole other area of research I think would be important to look at. I think it's clinical treatment trials. It's working out what works in treatment and for whom it works best. So most of my research career has been in both treatment trials of anorexia nervosa and bulimia nervosa, for example, a study of guided self-help in people with bulimia nervosa, so trying to translate evidence-based care into briefer forms that may be delivered by general practitioners, as well as in the sort of crunching the evidence base, so trials with the Cochrane collaboration where we sort of crunched numbers from a large number of trials and looked at what actually works in terms of treatment. The other main area of my research has been in sort of epidemiology and understanding the distribution and determinants of people with eating disorders in the general community, and that's where I've been sort of working with others at Western Sydney University and other universities where we've been working on what are the barriers, why people don't come for treatment, and what happens when people do attempt to come for treatment and the stigma that they face, and also the sort of lack of understanding sometimes when they try to access treatment. Absolutely, yes. We've currently got a couple of trials we're hoping to get up and underway. One in collaboration with a student, Francesca, at University of New South Wales. That was the study we were hoping to look at weighing and not weighing. That's currently going through ethics at New South Wales, but we hope to get that one here. And also other, as I say, we want to attract people here for their training, and particularly doctoral students in psychology as well as in psychiatry, and both in terms of the training experience, but also they all need to do some research, so we hope we can develop some more collaborations in terms of doctoral students, psychology students in terms of their research, and as well conduct our own research of our clinical outcomes in our patients. I hope it will have the impact that they will realise that we are a unit where we are curious, where we want to make changes and we want to improve things, and that they are helping us with that if they agree to participate in